thank you for tuning in to our webinar tonight. Today we have with us my very good friend and a very special person, Sreepriya Bhowmik. She is based in the UK, and she has over 25 years of experience in working in the field of education. She has worked extensively with children with special needs and also adults with special needs. And she has been head of departments of additional learning support departments in UK. And she has been regularly conducting teacher and parent training and workshops in the field of learning difficulty and disability. So thank you, Sreepriya, for coming. Thank you for coming in. So this webinar is called Silly Mistakes. And silly mistakes is something that we have heard from our teachers. I mean, ever since I have heard it from my teacher ever since I was a little kid. And I would get away by saying silly mistake. So it's all right. It's not a problem. And it always, I always used to think that what is it? Is it really a silly mistake? Because I knew it. Then why did I forget it? So it always used to bother me that why did I make that silly mistake? And teachers also would say that, oh, Vaishali makes a lot of silly mistakes. So what to do? She's a very bright child. So I never understood this. And there are many children, in fact, many parents who are watching us today who have gone through the silly mistake, phase. So I want to know, what is the difference between learning difficulty? Is it difficulty to learn? Is that the reason we make silly mistakes, or is it some kind of a disability that we have, which went undiagnosed completely in the beginning, and was never catered to later? So, if you could just throw some light on that.
That's a very interesting way of starting. Silly mistake, before we start, if I'm talking about learning difficulty and disability, silly mistake is something which is brilliant. As a teacher, I look for my students making silly mistakes because there's a difference between making a mistake and a silly mistake. When they start making silly mistakes, as we call it, that often shows us they know it, they want to get it out from their head, and there is the confusion. So there is a difference between mistake and silly mistake. So sometimes silly mistakes can give us as a teacher a big understanding of the child's learning, whether they have learned it or not. Now, the question that you have just asked is learning difficulty and learning disability. There's a big difference. They often come across to be same. My child has got learning disability, learning difficulty. The difference is learning disability is linked with the overall cognitive impairment. So when the child has got a cognitive delay to a great extent, that will be considered as a learning disability or a physical disability. Whereas learning difficulty means that they would not affect a cognitive deficiency. So it's not linked with a general intelligence issue. So basically a child with learning difficulty can be the brightest button in the class, but on paper it's just showing that, oh, my child hasn't learned anything because they've been making the silly mistakes, as you just rightly said. So it's very crucial for us to understand that the mistake the child is making, is it because of a difficulty which can be linked with lots of different things, which we will be talking about at a later stage in the webinar, or is it a global developmental delay which has affected the child's cognitive ability or the ability to understand the concept, process the concept, and it's kind of the overall there's a delay in it. So often what happens is at an early stage, if the child's need gets undiagnosed, so it's like, and you have been focusing on either on only the behavior of the child, or he just doesn't understand. I've told it 1,000 times, but still the child is not getting it. Before jumping into conclusion about my child is not paying attention, my child's behavior is appalling, my child is doing this, all the negative things that we can think of, it's crucial for us as a parent and as a professional to know why. Because if we don't know why, we won't know whether it's a difficulty or a disability.
Mm-hmm.
And then slowly, without proper intervention, proper assessment, the gap will increase. So, what could have been just a learning difficulty with right intervention, right strategies put in place, the bridge could have been built, but the gap has widened now so much that
Mm.
it is being shown as a developmental delay. And that has a much more long term effect. So, this is where it's very important when the child is making a mistake or showing some sort of delay or you're concerned, you first focus on the why, then look into how to solve it. And when you know the why, when you have tried to solve it and it's still not changing in spite of having all the things, then you move on to the next step. Is there a kind of a global delay? But the
Mm.
global delay, some certain global delays you can straight away know. They're from birth.
Mm.
So I'm not talking about those things. I'm talking
Mm.
about those kids who have been in a mainstream school, have been struggling, but there's been some issues which has been cannot be identified. That's where you start thinking about okay, delay or a difficulty.
Okay.
The diagnosis is something, knowing why is something I would say is a real important thing first before we move on to, oh my God, my child has got there.
Okay. No, I understand that, and but many of the parents um, struggle with why. I mean, where can the parent start when answering the question why? What signs do you think the parent should be watching or looking for uh, to diagnose
Okay.
the first
So,
stage? Yeah.
so when should you be concerned as a thing?
Yes.
So what you need to remember is every human being, we can, if we divide the learning part in four different aspects. One is social, emotional, and mental health,
Mm.
cognitive and learning,
Mm.
communication and interaction, and the physical. So there are certain things they need to uh, you need to look into. So when it comes to, if you first thing you see that my child is not paying attention, which is one of the very common thing we always say, my child is not paying attention, doesn't listen. It
Mm.
doesn't matter what I say, it doesn't listen. They can't remember things. My child is reading it 20 times. I'm making sure that at home I'm sitting with my child till 10 o'clock at night. Still, next morning, nothing. Still, it just refuses to do it. All these things are very common problem we face every day. I'll give you an example. Very recently, I came across a 6-year-old child, and the parent was very concerned that every day I'm getting complaint from school. She doesn't sit still. She's not responding to her name. She doesn't do this. She doesn't do. So it reached a point where the parents were actually quite. They used to get stressed about going to school to pick the child up because it was like it was a nightmare. And school wanted the child to be assessed for suspected autism, ADHD, all these things. And then I started working with the child, and I realized that it was not autism or anything, but something struck me that is there some issue with vision and hearing? And then we kind of identify that the child was actually not being able to hear from one side. And there was a
Okay.
vision convergence issue. So if you come to think of it, that's where the child was actually not responding to the name because she didn't know who was calling and could not
Mm.
follow the things because her vision wouldn't converge. So there was an issue. So when you have kind of explored all the possibilities of that, okay, my child is not walking. Is have I done enough? Have I given enough support to see that why is she not doing it or he not doing it? You should be concerned. Say for example, it's almost 3 years old. My child is still not talking. You should be concerned. My child is 6 years old. The speech is not clear. You should be concerned. My child is not making eye contact, doesn't have any friends. You should be concerned. At We have got a tutor at home. The child is going to the school. School is also very good. You are happy with the support the child is getting. Still, my child is not making progress. You should be concerned. The child says everything is fine at school. Doesn't share
Yes.
what's happening at school.
Yes. Mm.
Everything is fine. Homework, yeah, I've done it. At school, classwork, never finishes classwork. Copies wrong. You should be concerned. These are certain telltale signs. Compulsive lying. That's another thing parents should watch out for. If a child starts lying, you know there's something not right. The child is, because we tend to lie when we start feeling insecure about certain things.
Yes.
If the child is refusing to go to school, if the child appears to be anxious, academic expectations, we have often as parents we have very high expectation of our child. But do we ask yourself, do we have a realistic expectation? Not everybody is meant to be achieving 90%. But the effort my child is putting in, the support that we are giving, is my child performing at the level where we realistically think he should be? If not, you should be concerned. There's a big discrepancy between what the child can tell and what the child produces on paper.
Mm.
That's very important. Another thing that you can look out for, that, oh, all of a sudden that child blurts out something completely irrelevant, which probably you were talking about in the morning, and then all of a
Yes.
sudden evening the child has said something related to that. Sometimes you should be really concerned about that and looking into it, because probably the child had been processing it for the whole day. Has the child been through any trauma recently, had a head injury, and the performance has changed after that? You should be concerned about that. Is my child's handwriting is really bad? Many people complain about it nowadays. My child's handwriting is really bad. You need to
Yes.
ask yourself that, is my child actually getting enough opportunity to develop the fine motor skill? Because most of the time our kids are nowadays on tablet, so they
Mm.
don't even use a laptop to use to work on the finger movement. So it's all like this. So with one finger movement, you can never develop the fine motor skill or the eye hand coordination, which is so important for developing your handwriting. Handwriting is
Mm.
awesome, but the child has not been exposed to opportunities to develop that eye hand coordination or the fine motor skill.
Mm-hmm.
If your child walks clumsily, doesn't enjoy going to PE, doesn't
Mm.
like doing physical education or any physical activities, is it because they have got a very sedentary lifestyle at home? Nobody exercises, nobody does anything. It's kind of a family where everybody is happy to sit and do nothing.
Mm.
That can be hereditary. But if there's
Mm.
an issue with the gait, my child still doesn't want to get changed.
Mm.
I have to help my child. Doesn't eat properly. Can if you're using fork and knife, can my child use cutleries properly? Or if you're using hand, can my child's hand movement go like this? Look into all these things. And if you think that, oh, no, these are not normal, this is something I should be concerned about. Yes, you should be concerned. Don't start being concerned about, oh, my child didn't get 90%, got 88%. I know I have had people asking me, my child is not achieving because my child got 88% and not 90% in
Mm.
all the subjects. All the subjects, they won't get 80%. We are all individual. That's where individual differences come from. So
Mm.
any of these things you should be concerned about, which is where they are not showing age appropriate development, or there are certain things, there is as a parent you will be concerned, as a teacher you will be concerned, and especially if your child starts lying, goes
Mm.
quiet, or if there's a drastic change in child's personality, look for it. Try to find out the why. Always ask for why before jumping onto a conclusion about any possible diagnosis because you have read it on Google or somebody else said or suggested. So,
Yes, yes, yes. Google. I mean, it's good. Thanks for Google that we are informed. But yes, taking the right decision at the right time is something that I think should be consulted and
exactly.
thought through. Thought through. You mentioned trauma. Uh, I have been working with children for a very long time, and I've met and worked with various children who have various levels of understanding and knowledge, ability to explore and ability to articulate. There has been a student I have been working with for a very long time, and it comes from a teacher's concern. Uh, a very bright boy, and he has some vision difficulty, and it was diagnosed, I think, a little late in his life. He's around 13 now, and he has been coming to me for the last 3 4 years. Very, very nice, very intelligent, creative boy. But if something which goes undiagnosed, say at the age 6 or 5 or 4, do the repercussions stay lifelong? And
Depends.
and also, can we intervene anytime, I mean, while the growing up years, in the growing up years, to help the child, or when the child has become an adult, to help him?
Absolutely, absolutely. It's never, I always believe that it's never too late.
Mm.
It's never too late. Especially in today's age, it's never too late. Yes, we probably will not expect the progress in like the magic wand. We haven't got
Yeah,
it yet.
yeah.
But it's definitely, at least you can give the child strategies to cope with the difficulties. And
Mm.
then motivate the child to use it. Say, for example, I'll give you an example. I recently assessed an adult for dyslexia.
Mm.
She is 48, and throughout her life, she had struggled, and she never knew why she had struggled. So,
Mm-hmm.
when I assessed her, she was quite severely dyslexic. And she was like, oh, now she was relieved that, oh, now I know. Will I
Mm.
be able to? I want to pursue higher studies now. Will I be
Mm-hmm.
able to do it? Because my difficulties are, you know, it was quite severe. I said, of course
Mm.
you can. So what we gave her was a reading pen and a speech to text software. And that has changed her life because so she practiced using the reading pen. So basically you scan it over a textbook and it reads
Mm.
out. So her entire struggle of reading gone.
I get you, because this boy I'm talking about is has lost a lot. I mean, has lost interest in academics for some odd reason. He doesn't want to study,
Hmm.
and it is difficult for the parent to understand what is going on. So maybe there is something that needs to be looked at a little closely.
Absolutely, absolutely.
Mm.
First of all, I think as an adult, as a parent or as a teacher, very important thing that we often forget to do is we forget to look at the world from the child's perspective.
Mm.
We talk to them as an adult. We see the world as an adult. Just try to go back to the child's age and see the
Mm.
world from there. Don't forget, as I always tell the students, that you know what, I have not forgotten how it feels to be on the other side of the table. So
Mm.
I've been there, done that. I don't forget it. I'll make sure that I don't forget it because that helps me to understand them. So similarly, if the child is 13, you have to remember one thing. As it is during teenage years, nobody likes to study.
Yeah.
If anybody, so there will be very few people who will say, "Oh, no, I loved studying when I was teenager." Yes, there are people. I'm not saying there isn't any, but most of them, general trend is people will not enjoy studying. People will go against what adults say, because
Mm.
remember the hormonal changes are kicking in, the puberty is kicking in. So as it is, the brain gets flooded with too many sensory changes,
Mm.
physical changes, chemical and hormonal changes. It's a riot going on in their head. On top of it, with the academic pressure, social pressure, all these things, and especially with this young
Mm.
boy, he has got such a huge amount to catch up. So
Yeah.
we have to make sure that we space it out according to his convenience. So that first thing should be to get him back motivated, to make him
Mm.
feel that, oh, I can do it. When they do a very simple thing independently, all of a sudden they go, oh, I can actually do it. So that way the gap can be decreased. And but
Mm.
it needs to be motivational. It's not motivational. When I say motivational, doesn't mean the child needs to sit through motivational talks about all the big things that adults, again, the adults say, if you do this, this is going to happen. It's all fair enough.
Mm. Mm.
But that's not how a teenage brain works. So they
Mm.
have to know it like kind of, yeah, quick fix. Their life is very quick fix. And for him, like, I've struggled enough.
Mm.
I can't see. It's still in his mind that there, because of my visual difficulty, I couldn't see. And there are lots. If you explore his learning needs, you'll probably see that there are lots of misconception that has formed in his brain.
Yes.
So,
Yes.
so there he has got lots to undo. So because of his visual difficulty, which was undiagnosed, so there are lots of compensatory strategies or learning that has been put in place in which probably are not right. And with age, he has realized that, oh my God, all these years I have learned it all wrong.
Mm.
I'll give you an example. A child with visual issue. Well, that's was assessed for color blindness because nobody knew she had a visual convergence issue. So everybody was focusing on, oh, she doesn't know the colors, so she's colorblind. She's colorblind, which is very exceptional, unusual for
Mm.
girls color blindness. But then once that visual issue was diagnosed, it was realized that when she was being taught about color, it depends on which box she was focusing on. So brown, and we are trying to teach her brown, but she was looking at probably yellow, so she learned
Mm.
that with brown.
Okay.
So there were lots of wrong learning had taken place. So we don't know, and we can't really go back to each and every day and see which learning took place when and undo all those things. So we
Mm.
have to remember with the child at that age, every day he is facing that, oh my God, I have always learned it wrong. And he
Mm.
would necessarily associate with his visual difficulty. He probably would associate with being stupid because peers are not always very kind, teachers are not always very kind, parents are not always very kind. You can't even understand this. Are you stupid? We have been talking about for the last 10 days with all good
Mm.
intentions. But the way the child is
Yes.
processing it is very different. So you have
Mm.
to start thinking it from the child's perspective and try to see what are the difficulties, what are the things that we can expose the child to so that he gains that self confidence, that independence, that wow factor that, oh my God, I can do it. And sometimes the simplest of the tasks can make a huge difference. Uh,
Mm.
a child who was giving her GCSE exam, uh, I think 5 months before her GCSE exam, she realized that she could do double digit subtraction independently. And that just like she was like, oh my God, I can do maths now. I said, yeah, you can do maths. I was like, yeah, you can do maths. And bless her, her confidence, like all of a sudden became such a, wow, I could do it. And then she managed to score a B. I've got no idea how she managed to score it, but it was just to do with that the information was there, the ability was there. She just needed that, wow, I can do it. And she just did it. So she's now training to
Mm.
be a nurse, which needed
Oh.
maths for her entrance. I had another student with severe maths phobia. She has just
Mm.
completed her master's in maths. She used to get rashes all over her body as soon as she used to sit with maths. So yeah, so it's you need to get that point of, oh, I can
Mm.
do it. And then many times they just like give them the strategies, give them the tool, and they they will do it. Okay.
All right. Yeah, thank you. Thank you. Thank you for staying, those who have stayed and tuned in again. And sorry for this little disruption. Anyway, we were talking about the disappointments that children go through when they are not unable to understand concepts. And you were talking about dyscalculia, which
Hmm.
goes undetected or undiagnosed for many years. Yeah.
And also another thing in maths is if they're of a secondary age and you're working on a concept like fractions or ratio
Hmm.
percentage and you're my child doesn't want to do it, can't do it. First check whether the child's basics is clear.
Okay.
Because we often try to focus on the thing without looking into the foundation. So there's no point in trying to fix the upper floor of your house if the foundation is weak. So
Absolutely.
just
Absolutely.
spend, instead of trying to teach the child ratio and proportion, use 2 weeks to just try to see whether he knows how to do addition. He actually
Hmm.
understands the concept of subtraction,
Hmm.
multiplication, division, place value, bigger number, smaller number, what number comes after, what number comes before. Those things we think is very primary school, but these are the foundations. They are taught at the primary school for a reason. So go over them. Once you know that, okay, the child has got a very clear understanding of it and can actually carry out those process mentally,
Hmm.
then move on to, then try to teach the topic in hand.
Okay.
Because often we don't realize the child still uses lots of needs physical prompt like counters or something to do those additions or
Hmm.
subtractions. So doing it mentally is a very very high level skill, and it's not meant for everybody.
No,
When I
also
try,
in yes, yes, that is true. And also the thing that you said about rushing with the syllabus and finishing lots of concepts together. I think that is something that is there in the Indian education system. We
It's
are,
everywhere. It's
oh, it's
everywhere.
everywhere.
It's everywhere. It's when I'm talking about, I see education as a whole. So I do my that's my favorite pastime. It's
Hmm.
everywhere. Everybody's rushing to finish a syllabus. So in my experience, it's kind of people forget because of we are in a rat race to
Hmm.
reach somewhere where we don't know where.
Hmm.
We forget to work on the foundation.
Hmm.
So please, as if you are worried about your child's maths or science or English, whatever, before jumping into conclusion about that your child is naughty, your child has got this, your child has got that, first check, does my child know the basics?
Hmm.
Only then we can take a decision about have we ticked all the boxes. My child, there is no gap in my child's learning. My child hasn't got any underlying conditions. Only then start thinking about giving them a label. So
Hmm.
don't go with the behavior that is being presented. Try to find the why. Behavior is a way of communication. So
Yes, and
it's
I think that also works against their confidence, and they then become underconfident, and then because I work with a lot of children who are underconfident just because they are not good at something. They think that they are not good at something. So I use a lot of drama to bring children out of that fear of kind of going wrong,
hmm.
or fear of not understanding, or unable, fear of saying something which he's not or she's not really clearly
It's my first hand experience. She goes for drama because she had some speech issues, and instead of going for speech and language therapist, parents decided to let's try drama, and then if things doesn't improve, we'll go for speech and language therapist. And one day they were doing a session on inhibition monster. So
Mm,
she came out of the class and asked mom, and it's a very first hand experience. So
mm,
she asked her mom, Mom, if I do to the inhibition monster, will I be able to read? And mom said, Well, you can try. So she came home and she took her first book, which she hadn't touched book for ages because she was so scared of reading and going to school.
yeah.
So she was sitting with the book and she got and did whatever the drama teacher said. It looked funny, it looked odd, but the parent like, okay, let's see. And then she just read k actor cat, b actor bat.
Mm,
I can read. Yeah,
mm,
I've let the inhibition monster go. Inhibition monster is scared, and she
mhm,
just was so happy. And since then, she actually started reading. Not reading as it
mm,
like fluently reading, but actually started taking active interest in reading.
mm.
So that drama session helped her immensely. And with that, the confidence increased.
Yes. Yeah.
Then attention span, dyslexia, dyspraxia, there are lots of issues with physical coordination and all those things. So cross-lateral development, we often forget.
Mm,
And with joining something like gymnastics or some kind of sports, you are
mm,
indirectly helping the child to develop a spatial awareness, that cross-lateral awareness, which is such an important skill for academic or any kind of
mm,
general development. So all these
mm.
things doesn't have to become given to a child in a prescribed manner. Okay, every day 10 minutes of cross-lateral exercises. No, you don't have to. You don't have to. Or you don't have to send them to the gymnastic class thinking that he or she has to represent India in Olympics.
Mm.
Do not send the child to these
Yeah.
co-curricular activities with this huge ambition that they have to make a career out of it. If
Mm,
they have got the talent, then hone it.
mm,
But don't try to, stretch the child and expect the child to be a topper in everything they're doing. Let them give some free time for their mind to relax and unwind, because that is quite important, especially
yes, absolutely.
for the mental health. It's
Hmm.
so crucial nowadays. I don't know whether you have seen this. uh, so many cases of depression,
Hmm.
anxiety, self-harm has increased among youngsters. One of the
Yes.
reasons is they're being do this in school. They come back home, exam tomorrow. Even if they're
Yeah.
going for a class, they have got an exam there. They have got so generally a student's routine is you wake up in the morning, go to school, if you're in a family where they believe that early morning before going to school you have to study, so then study, school, expectation. Come back home, they don't have much time to go out and play. Even if they're going out and play, we prescribe that don't play with so and so because so and so doesn't go to this school or doesn't behave the way we would expect you to do. So there are lots of expectation from parents. As a parent, you tend to decide that who is your child's best, should be your child's best friend. But friendship is something that comes from a child's heart, not always from. So there are also, that is also controlling. Then tuition, one tuition after another, one tuition after another, come back home, complete the school homework, prepare for school exam, tuition homework. By the time the child is going to bed, it's maybe 12 o'clock at night. Then the child spends quite a lot of time on the video games. So the brain is actually not getting time to unwind. And that's why we are also seeing a huge rise in computer games addiction, because lots of learning is on internet nowadays. So there's no, you can control what they're pretty smart at hiding which website they're actually on. So you as a parent, by putting them under so much pressure, you are actually losing control of their learning, because they're one step ahead in case of technology. So there are lots of things you have to make sure that the stress level you can control with your realistic expectation.
Yes. Um, we just you just talked about memory, like children run away from memorizing also. So this is also something which is very common. Some of the children just don't want to memorize. Is it because they are not clear in their concepts, again, just like maths and science, and that's the reason they don't see the point of memorizing, or cannot memorize, or there could be a trauma associated with not being able to memorize?
There are lots of factors with memory. Memory is a very
Mm.
interesting concept. So the memory is not only just storing information, but it's
Mm.
also about retrieving the information when it's needed. So
Yes.
whether the child has got weak memory, is it a long-term memory or a short-term memory, working memory? So there are lots of
Mm.
different parts of memory. So the difficulty can be in any part of it, and that might be seen as, oh, my child doesn't want to memorize because he probably remembers it, but he just
Mm.
doesn't know how to retrieve it. And
Mm.
also, if a child is somebody who's a very logical learner, if it doesn't make sense, I don't want to store that information.
Mm.
Simple. So I don't want to memorize. So that can be seen as, oh God, you're opposing. Also, you have to remember, in today's generation, they have got information like this. They don't really
Yes.
see the need for memorizing things, because it's everything is available at the press of a button. So the
Mm.
urge, or the intrinsic need, the motivation to memorize something is much less, because we are asking the kids to think out of the box. Everything is very
Mm.
multi-sensory, so many things. So they all have their unique way of storing the information. So if you're asking them to memorize and then just uh, take it out during their exams, quite a few kids, they don't see the purpose of doing it. And again, that is one motivational part of memorizing. But there can be some serious issues with memory, where they can store information for, they don't have any issue with long term memory. So what I learned,
Okay.
now I can still tell you after 2 weeks. But
Mm.
but those with kind of specific learning difficulties, they often have issues with working memory, which means that processing the information and then retrieving it immediately is something. So the teacher has said something, and by the time I have processed the information, and then teacher asks me, so what did I say? I've got no idea what you said, because you have just asked me. I have
Yeah.
processed the information.
Yeah.
So by the time they have processed the information, the teacher said at the beginning of the lesson, it's already end of the lesson. So when the teacher asked me, what did I tell you 5 minutes back? I haven't got a clue, because I was still stuck on the first information. And it's nothing to do with attention issues. It probably is a
Okay.
very slow processing speed. It's
Mm.
probably difficulty with working memory.
And
So
maybe if the teacher pulls him up then, or her up then, and says that, okay, why were you not paying attention? So that could also harm
yeah,
his, yeah, I
because in
mean,
his mind, I am paying
in his
attention.
mind. Yes. Yes.
I know what you were saying, but you're not asking me the question because I'm still
Mhm.
stuck there.
Yeah.
And so it's quite important that when we are teaching the child, we actually go over the learning, whatever we have taught the child, even as a parent or as a teacher, at a regular interval to check the child is actually able to retrieve. Often we see that, oh, he studied a lot, but his exam grades are not reflective of his effort.
Yes.
Because probably the thing is that I have learned everything, but I just don't know how to retrieve
Can't.
information. So the issue is with the retrieval. So that's why there's a whole process of we can have another webinar on online.
Depletion of the attention span of children over the years, even
I can't hear you clearly, Vaishali.
um, is that
I can't hear you, Vaishali.
some? Yes. I'm talking about attention span. Hello.
Okay, yeah, I
Okay,
can hear you
storm
now. Yeah.
actually over here in Delhi. Yeah. Yes. So the weather has been acting funny lately. Yeah. Anyway, yeah, so I was asking about attention and attention deficiency in a child. Now, is there something that can be done to span back to the child? Because there are many parents who actually go through this while is and off the cuff people can just nowadays ADHD, ADD, these things are very commonly used and said and diagnosed. So a parent always fears that does my child have ADD or ADHD? Oh, should I take him to a psychologist? What is it? Because he's just 7, he's just 7 years old and he does not sit in one place. He doesn't, and let me tell you, we only work with children who are like this. All 90% of my students are like this, and I don't find any problem working with them. Probably I too am ADD, but if you could just tell us everybody, when should we get concerned with ADD and ADHD? When is the right time
Okay.
to go and ask for
Okay.
help, professional help?
ADHD and ADD is a very in thing now. It's very
Mm,
easily kind of diagnosis given out. It's quite there's
yes.
a big movement going on with this that are we diagnosing ADHD a bit too early, which
Mm,
I think might be. I'm a bit of an advocate for that. We are diagnosing ADHD and ADD a bit too early for that, because when we are working with the students who has got like okay is on high dosage of medication for ADHD and ADD, and
mm,
I'm doing a needs assessment or trying to just identify the child's needs so that we can put an intervention in place. And we are seeing that often the processing speed and is an issue. Weak
mm,
working memory is an issue. So there are lots of other conditions which has never been catered to. As I was
mm,
saying at the beginning of this whole webinar, is we need to know the why.
yes.
So okay, uh, in nowadays, funnily, that a 5-year-old child is expected to sit still from 8:30 till 3. They can't. Physically
No.
they can't. That's against probably human rights, if I can say that. You are basically restricting a child. And
Yes.
also you have to remember one thing, which is quite interesting, that we are asking the kids to think out of the box. We are stimulating them in multisensory way. So
Mm,
these kids are stimulated. So some kids are
mm,
overstimulated, some kids are understimulated. So and they have got various way of uh, uh, well, how can I say, to
expressing.
express their stimulation.
Yeah.
Uh, so some kids are very physical. Some kids are quite laid back. Some kids
Mm,
enjoy the screen time. Some kids they don't. They would rather have a physical break. But
mm,
in today's world, if you see 90% of the kids, they don't get a proper decent break where they're not structured.
Mm.
Unstructured play doesn't exist anymore in their life. Even playtime is supervised by teachers. So the kids are not developing any resilience. So they don't have the skill
Yes.
set to resolve their problems. So all these things are putting psychologically putting lots of pressure in the kids. So they are, it's kind of the when we are young, our brain learns the chemical in our brain. They learn to regulate emotions, but we don't teach them resilience anymore. We don't teach them how to resolve a fight between two 4-year-olds anymore. We teach them, go and tell an adult. The adult will
Mm.
solve it for you. So when they're coming to the teenage years, they don't have the skill set to resolve their problems. So all these things are actually creating an imbalance in their brain development. So these things do have an effect. Now with ADHD, attention span, it's very difficult for a child to stay focused for 1 hour at a stretch. Most of the lessons are 1 hour 45 minutes. And
Mm.
ideally, the teaching sessions are somewhere between 20 minutes to 30 minutes. So if somebody has, because there are lots of classroom, the class has to settle down, teacher has to give instruction, the class has to get ready for the next lesson, but they don't again get time to get ready mentally for the next subject. So English followed by science, followed by maths, followed by PE. So continuously the brain is expected to change.
Mm.
And not all brains are geared up for that. So you will lose focus as an adult when you have, if you have to go for a meeting one after the other. How exhausted are you? So as an adult, if we can't swift from one meeting to other, we need a coffee break or a cigarette break or a coke break.
Mm.
Imagine these kids. So they are having lots of other changes. The development is happening, and we are expecting a lot from them. So these things are bound to happen. So that's why in school or at home, a break in between is so important. It doesn't mean that they have to go out and play. But in
Mm.
class or at home also, there are lots of small activities you can do to give them that much needed break. Or just let them be bored for a while. Because when you are bored, your brain learns to, you know, deal with unknown situations. And when you're talking about ADHD,
Mm.
yes, they have short attention span and being easily distracted.
Mm.
Again, as I was talking about that, they're being overstimulated anyways. So the brain from childhood is getting learning to get follow. Oh, there's a sound there. So all those quacky toys that you get, you press a button, it pops up, then it makes a sound.
Mm.
Anything you press, it starts singing ABCD. So the brain, you're actually, in a way, overstimulating the brain from the childhood. You're teaching the brain to respond to every single distraction that's happening around you. So I don't know if that is one of the reasons, but that is something I have found very interesting. That the toys are from childhood. The toys are exposed to give the child multisensory stimulation, and
Yes.
so are we actually preparing the child to be stimulated at every single thing that's happening around us?
Mm.
Maybe. I don't know. That's something we might look into. Forgetful or losing things. They might.
Mm.
Uh,
Yes. This is a big
yeah,
problem.
that can be a
Losing
genetic
things.
issue. You can forget
Yeah.
things, you lose things. But again, at the
Yeah.
same time, sometimes nowadays we get things too easily.
Yes.
So we don't really, the kids don't really have the urge that when we were young, that white rubber with a
Yes.
letter written on it was our prized possession. Okay, if it gets lost, we are like, oh, I've lost it.
Yeah.
It's okay. We have got 20 different types of rubbers to choose from.
Yeah.
I don't know whether it's they have lost the value added to it.
Mm.
Nowadays,
I
I
think
don't know.
this is a complete yeah, this is a different topic altogether.
Exactly.
We should meet again and discuss this.
We can talk, but these are the telltale signs of ADHD, that they forget things. So if you know that these things are not in place, so yes, they keep on forgetting. They are making mistakes in schoolwork.
Mm.
Again, you
Mm.
have, and but all these things can be linked with. So forgetting things can be linked with memory issues. Making silly mistakes or careless mistakes can be linked with learning difficulties like dyslexia, dyscalculia. So the concept is
Mm.
not clear. Short
Mm.
attention span can be linked with again slow processing speed. So the child is actually still processing the information. By the time the child has processed the information, I've lost interest and lost track of what's happening.
Yes.
The child has got undiagnosed ASD. I've got no
Mm.
clue what you're talking about, because this world you have put me in is very different from the world I am in. So that can be
Mm.
seen as a short attention span. Appearing to be unable to listen and carry instructions. Yeah, that can be an issue. But again, at the same time, have I got a hearing issue? Have I got a processing
Mm.
speed issue? Have I got a working memory? So once you have ticked all these boxes and you see, no, there are no issues with this, the processing speed is fine and everything is fine. Yes, then a ADHD diagnosis is probably much more relevant. That the child's processing speed
Mm.
is absolutely fine. Working memory is
Mm.
absolutely fine. The child's hearing is absolutely fine. There is no undiagnosed condition like dyslexia or dyscalculia or dyspraxia. So there's no reason for the child to lose attention, and it's happening all across. My child is okay in history but is not okay in maths, or he's okay in maths but
Yes.
doesn't like history.
Mm.
That is not a
Yeah.
good reason for a child to be ADHD. In fact,
Mm.
it's like all across, be it PE, be it dance, be it English, maths, science, irrespective of the subject or the concept. The child is always bouncing up and down. Yes, you
Mm.
should be concerned, but not because the child has been overstimulated or exposed and there's no structure in the child's life. Because many times,
Mm.
because we are so engrossed with our day-to-day life that we forget to provide that structure in the child's life. We are expecting the child to take up to do everything on their own, but they're still learning.
Yes, I mean this is something which I want to talk about. In fact, I think we are going to open the questions, out to the parents. They can ask. You can ask your questions now, and I already have a couple of questions. Supriti is asking, and this is a very relevant question. As a parent of 7-year-old, I struggled with the definition of realistic expectations. There is this utter confusion as to when to push the child and when to let them be. Can you please share a bit on this?
Uh, a realistic expectation for a child is absolutely a parent's decision, because I don't know your child, I don't know your circumstances. So what might be realistic for me might not be realistic for your in your context. But obviously, if the child is achieving the best you think the child is, and you have ruled out any possible hidden conditions, you should push the child. But the as an educator, I feel that your expectation should be that if my child is able to do this, okay, the child should thrive to do a bit better, but not
Mm.
because so and so son is getting 99 out of 100, you should also get 98 out of 100. Because if you know the child has been
Mm.
doing realistic, has been putting in realistic effort, as a parent you have been supporting, and the child hasn't got any issues with learning needs, then I think you have to set that expectation to yourself that okay, I'm happy with what you're achieving because this is your ability. But I know that it's very difficult for my child. He or she can't do it. And as a 7-year-old, every child develops differently. In most part of the
Mm.
world, the formal education starts at 7. And in India, I know people send their kids to school at 1.5, 2 years. So, like in Norway, Sweden, Germany, most part of Europe, which who are way ahead in the education league table, their formal education doesn't even start till 7.
Yeah.
So for a 7-year-old, in some ways, when I went to India last time, I saw that the parents' expectation was something that, as if they're going for their IIT entrance exam. So be realistic. If you don't put the child under that pressure at 7, the child is too fragile to handle that pressure of you have to do this because so and so is doing it. You know
No,
your
but
child.
yes, but the thing is that we as parents also we try to let them be at times. Like, okay, I will not push you. If you don't want to do this, don't do this. Uh, but is it all right to not push at all, or is it a good
No,
thing to just
definitely
make a push, just make a little push, and if there is a push back, then you kind of stop?
Absolutely. You have to have a realistic expectation as you asked. So, my realistic expectation for my little one is whatever work I'm setting for her based on her ability, she needs to finish it. Until unless she finishes it, she is not allowed to leave the table. So, like this morning, it was a fight because they're not going to school. So,
Mm.
but I knew her ability, so she had 3 sets of work she had to complete. But until unless you finish it, you're not allowed to go. So,
Mm.
as a parent, you have to have that expectation. You can't say, "Oh God, you have got this, so you are not going to do it." No, 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 no. You have to push. If you don't push, if you don't have that expectation, they will have a laid back attitude and they'll not progress in life. But have the realistic expectation. Like you have to be able to do this by this. Don't have that have to. But yes, you're expected to say if it's at a 7 I don't know if they're doing double digit addition. You might set a target that today you will try to finish this 10 sums, 1 page of writing and 2 pages of reading. So you as a parent, you know how much your child can do or what sort of sums the child is able to do.
Mm.
And so part of it can be something that she can do independently, and half of it can be something that you are actually teaching the child how to do. But let them finish it. So there's a completion, there's an expectation, but not that you have to do it whole day. You have done double digit addition. So, okay, I'll have to try to teach you 4 digit addition.
Mm.
Have you consolidated the learning of double digit? Explore in different ways. Can you actually do it? Putting it in word problems, putting it in a different context, mixing it up with addition and subtraction and see can the child actually identify when he like 5 additions followed by 2 subtraction followed by 3 additions is often a very good way of checking whether the child has actually learned the concept. Many times you'll see that they do 3 additions and they carry on doing additions. They haven't seen the sign.
Yeah.
But they can do addition, they can do subtraction independently. So, doing these sort of things. So, you're pushing, you're checking, at the same time, you're setting your expectation.
Mm. There's another question. I don't really get the question, but I think she's trying to say this is by Priya Kapoor. She's writing if the child is very reluctant in doing things which he or she was doing before and have started misbehaving now. So there are things that the child would do before, and now when the child is asked to do the now if when he's asked to do, he's misbehaving. He started misbehaving. He's just 5.5 years.
5.5 years is the age when they'll say no to everything. I told my daughter that you'll watch TV for 10 minutes. She said, no, 5 minutes. I said, okay, 5 minutes. And then she realized that it was, I've just reduced the time. So they will push the boundaries. And often they say no because it's that stage of development at 5. They will say no to it. And when you're misbehaving, then you have to set the boundaries that, okay, if you talk like this, there is a definite kind of a, no, I won't say punishment, but uh, like certain things will privileges will be taken off. So if you're misbehaving and if your child has got access to iPad or something, take it off for a number of days that it is gone away from you, because the behavioral expectation is different from academic expectation. Or I don't know where the child is refusing to do. Is it some kind of tidying up work? If it's a tidying up work, then the 5 year old and tidying up, okay, that's a different thing. But academically, 5 year old, if they were doing it before, they're not doing it. Maybe they are getting bored of doing it, or so if they could do it confidently in all situation, and you know that the child has got the skill set but refusing to do it, they're getting bored. Try to give them new activities, move on to them to the next level. But when in regards to the behavioral expectation, have a very clear cut definition of what is expected, and do
And
not.
also, yeah. So sorry. Go on.
No, and also do not try to give them that consequence for next day. So today you have done
Ah.
something, tomorrow you are going to miss it. Or no, there's nothing called tomorrow in their mind. They'll forget it. So then and there,
Mm.
whatever needs to be done, then and there. And also remember, do not mix it up. So if you're giving the child a consequence for misbehavior, that should not be carried out for a learning thing. So, say for example, recently an incident happened in my household only. My little one, 6 year old, forgot how to talk. And so there was a consequence for not talking properly. But during that 1 week of no screen time, she showed an amazing progress in regards to her maths and reading. So she got a
Mm.
surprise gift for the reading, but she didn't get the screen time back for the whole 1 week because the screen time consequence was for a different behavior.
Mm.
So, and do not try to mix it up. Otherwise, it will lose focus.
Okay, we have to move to the next question because there are a lot of questions, a lot of parents asking a lot of questions. I don't think half an hour's time is going to be enough to answer them. We'll have to, I think we should do another webinar, maybe a workshop with parents, rather doing a webinar where we can face-to-face talk with some of the parents and
Absolutely.
work with their issues. But two very, very important questions have come. Um, our child tends to get hyper, and this is Nikhil writing. Our child tends to get hyper and finds it hard to concentrate and focus at the age of 7 plus. He started speaking late at the age of 4. While there is improvement now, scolding him a lot to get him disciplined affects him negatively at times. What are the ways we can help channelize his energy and help build focus, concentration, or confidence in him?
Okay. Obviously, the child has developed speech quite late, as you said. So
Mm,
there is, we can already relate it to something like processing of information. So the child is probably taking a while to process what you have said and then interpreting the action and
mm,
then carrying out. So there's a huge gap between what you have said for him to process the information, decide on the action, and then actually doing it. So
doing
when
it.
we're telling the child off or when we are putting a kind of pressure, it's not adding to the child's processing speed, it's delaying the child's processing speed and the whole confidence. So
Mm,
do not, first thing is, do not tell the child off. Give him one instruction, simple instruction at a time. Let the child complete the task first, praise, and then move on to the next task or whatever instruction you want to give the child. So, if
mm,
you want the child to open the book and start reading, first tell the child, "Can you get? We will be now reading." The child has processed the information that, oh, we'll be reading
mm,
now. Get
mm,
the okay, got the book. Open the page, number one, whatever. If the child knows the number, good. If not, guide the child, open the page. Now let's
mm,
start reading. Rather than go quickly, go and sit down. Probably the situation is go to your room, get the book, and we'll start reading. Start reading, and I'll come and join you. Forget it.
yeah,
He probably has
it is
just
not going to
realized that
happen. Yeah.
he just probably realized that I'll join you, and he has created a picture already, which means
Mm,
that I've not done something right, and you're going to tell me off. So, what will be my first step is push you off from me. And how can I push you off from joining me? Is by doing something by which you will start telling me off. Because that means you
mm,
will probably end up being just do whatever you feel like. I can't deal with it anymore. And you
mm,
leave.
yeah.
Give a very clear instruction of what is expected. Let him complete that task, then move on. And I don't know if the child is already receiving speech and language therapy. If not, I would recommend that you should consult a speech and language therapist to work with him on the receptive language development, because that is very crucial before, because even if the child is talking, the expressive language is fine. What the child is understanding is very different. So a speech and language therapist might help you with the development of receptive language. So that is something you can focus on, and make sure
Mhm,
that you break the instructions in really small step, one at a time, to build that confidence that, oh, okay, I'm not getting told off and I've actually done
mm,
something. So everybody is happy with me.
mm. Okay, we have another question. In fact, I would really like to apologize to all our viewers for that, delay and interruption that happened. But internet and times are such that these things keep happening. We have another question, which is a very, very important question. Uh, Amrat Acharya is asking this. He says, it is said that up to 7 years, the children register all their learning into their subconscious mind. What would be the right kind of learning or teaching that we can give during such times?
I think one of the main focus that we need, we always say with the kids, first teach them to be a good human being. Get the right values, get the work ethics, develop the pre-learning skills. After 7, they will learn. If they haven't got a learning disability, even if they have got a learning disability, every child learns, provided we give them the right environment and the right support. Every child learns. Have that expectation. Give them the pre-learning skills like developing their visual processing, auditory processing skills, fine motor skills, bilateral confidence, spatial awareness. There are lots of associated skills which need to be developed before the academic learning takes place. Following instruction, making sure that the child has got all those basic skills in place, then teach them. Because before that, yes, they learn subconsciously, but if they don't know the meaning of it. So it's basically, in some cases, it's rote learning. They
Yeah.
register A, B, C, D, E, F, G because from birth, every toy they had pressed, it goes A, B, C, D, E, F, G. And so it loses the value. They don't understand what they represent. So you need to start giving them the exposure to building up that knowledge base, not like
Yeah.
learning. So pre-learning skills, so that
Mm.
they have got the skill set to manipulate the information when they reach when the brain reaches the stage of developing or structuring the formal learning. So even in ancient India Vedic system also, learning, like, it only started after 7, when they entered
Yes.
the brahmacharya
Gurukul.
stage,
Yeah.
Gurukul
Yes.
system, so the late childhood.
Mm.
So most of the formal learning, meaningful learning, I would say, uh, a child starts from the age of 7. Before that, it's whatever you teach the
Is
child,
building the basics
they rote
of
learning,
your
which is not
being.
a meaningful learning. So what happens is you you technically see that my child knows everything, but when it comes to the application part of that learning, it doesn't exist. And that's where
Mm.
most of the education system, lack of innovation or lack of application, which we see at a later stage happen, is because of this, that they wrote learn, and we judge the child's ability based on whether they scored 99 out of 100. So there are many students who scored 40 out of 100, but because their concept is very clear, they did really well in life. But
Mm-hmm.
many of the toppers in the class are okay, doing good job, earning good money, but they're not innovators, they're not entrepreneur, they're not making a mark. So it's again, you have to make sure the child's basic ability to manipulate the knowledge is developed during that stage of development.
Also, I feel that you, just like you said, become a good human being. I think basic life ethics and how to lead a life, how to respond and not react to situations.
Exactly.
Yeah, it this is something that a child imbibes before 7. And I keep telling every parent that I meet that you have to be an example for your child. So if your child is misbehaving, see if there is any misbehaving going on, in the household between other people, or if the child has become mute. Like there was a child I was working with who was a selective, mute person. uh, Maybe there's something that she has seen at home, like maybe there's
Yeah,
some violence which
absolutely.
she has been exposed to, like some trauma. So I think
Absolutely.
yeah, till 7 years of age, parent, according to me, should be very wary about the kind of people the child is around, be the teachers, be the people at home, outside home, especially the teachers, because I feel a teacher with a big heart is very, very important for a child in a
Emotional
child's
well
life.
Emotional
Yes,
well-being is very crucial at that point of time. Well,
yes,
throughout your entire life. But as you
yes.
rightly said, that selective mutism, post-traumatic stress disorder is a very, very, very common cause of lots of learning issues, and things when you dig deep into it. And
Mm,
often we don't realize it because every child is different. I've seen lots of students where um, I remember one student I assessed when she was doing her A levels, which is our 10 plus board
mm,
equivalent.
mm,
Uh, and when I was assessing the child, and she had all her background reports were based on she suffers from anxiety, blah blah blah, all these things. And during the conversation, she said that, oh, actually, can I tell you something? I said, yeah, tell me. She said, my words dance. I said, oh, okay. Have you ever told that to anybody? She said, when I was in reception, so when she was 5 years old, she said that to her teacher, and her teacher said, oh, don't be silly. And since then, she never spoke about it to anybody.
mm.
And and she had worked really hard to overcome her difficulties and never spoke to anybody about it. So with that, continuously putting herself under the pressure and no and trying to swim against the tide had led to the anxiety. So she was receiving medication, counseling, but she never actually had opened up to somebody. Another student I had worked with, she was around 17 or 18, and she was referred to me for assessment because school was extremely concerned about her academic performance, and they were sure that she had learning difficulty. When I assessed her, all the scores were within the normal parameters. And then I was talking to her, and then all of a sudden, and then she left. 2 days later, she came back to me and she said, I want to speak to you. I said, okay.
Mm.
And then she disclosed that she has been a victim of gang rape
Oh, okay.
at the age of 12. And she had never told that to anybody. And
Mm.
and she like literally opened her heart out. So, and she was an orphan, so she didn't really have
Mm.
any support. She was in foster care, and she was in a very strange social situation, and she had held it into her heart for such a long time. And when I said, why did you
Mm.
decide to tell me, because I don't even teach you, we have met only once. And she said, because you're the
Mm.
only person in my life who, without knowing me, asked me, am I okay?
Mm.
So that one question from me, are you okay, made that huge difference. And so there are lots of things that they don't talk about. Parents talking to them, are you stupid, have you lost your mind, he can do this, you can't do it, why can you not do it? We are always giving them negative feedback. The amount of energy or enthusiasm we show to our kids by telling them what they can't do, we don't even give half of that energy to the small things they can do. We
Mm.
often tell them, very good, well done. But the amount of energy we spend on talking to them, are you stupid about, see, he can do the, I've been telling you that energy creates a lot of trauma in their child's mind. So you really need to, that's something that parents need to consider, that
Yeah.
how are we talking to? Is it affecting the child's confidence? The teachers, one of the teacher I know, to me only said that was a point of asking you a question. I can ask a donkey, donkey will be able to answer. She didn't even realize that how it would have affected a 12-year-old child.
Mm.
It had a long lasting effect on me. I overcame it because I that was my personality, but also with the support of lots of other good teachers I had in my life, my
Mm.
personal experience, and lots of other things that kept me busy. And I had a really nice family. But those things we casually say to the kids without realizing that how it affects the child's personality.
Yes.
That
Yes.
has a
Absolutely.
huge impact, and
Words.
that affects their learning a lot. So we often need to think about what are we saying to the child? Is it stopping
Mhm.
the child from blooming? So yeah.
There is a very important question which has come in, and we see it. It's from a single parent, and single parenting is also something which is very common these days. She writes, "My daughter is 12 years. She cries every time on small issues too. Sometimes she talks very sensibly, but sometimes she is not able to express at all. I'm a single parent, and I, along with both my daughters, have been through a lot. People around her, be it a friend and family members, are fed up of her crying on little issues, small issues. I am failing to understand how to deal with it. She learned things late. For example, she started speaking late, started reading late. Although she has now come to a pace, managing to get a 67%. So need to understand how to deal with. She wants to understand how to deal with her daughter.
I think you have answered your question. You have just not realized that you have answered your questions. She has come to a pace of 67%. Please do not measure the child's progress with 67%. That 67% might be actually 200% for her.
Mm.
So maybe she was supposed to operate at 40%, but she has pushed herself to that extent where she has reached 67%, which is she has really pushed herself a lot. And with
Mm.
the environment she is in, probably she is. She has got traumas, as we were discussing. I don't know the background of the single parenthood. So there might be that she has been exposed to some trauma, which with the puberty hitting in is having an effect on her emotional development. That is affecting. If it or if there's an undiagnosed learning needs, as I can relate, as I was talking about a case very earlier on, where the child has pushed herself so much that the child has reached a point where I can't do it anymore.
Mm.
So every small thing which I am seeing as a threat to my strategy, coping mechanism, is making me feel vulnerable. And crying can get your attention. So maybe
Okay.
you should start looking into getting a child counseling, getting her assessed for the needs, because as you said that she had delays in everything. So if there was she had hit all the developmental milestone delayed, has she ever been assessed properly for her needs? Like what is exactly has she got? What are her needs? So why did she reach it? Late. So, is it a global delay, or if it's a speech, is it because she has got undiagnosed glue ear or a low level hearing loss? Is it some vision issue? So, there are lots of undiagnosed conditions which we do not look for, and that can affect everything, every aspect of learning. So maybe before being fed up or before measuring with 67%, be proud of that 67% and give her that positive feel that I'm so proud of you. In spite of all odds, you're doing it so well. And then start, and then probably she will start talking about what is it that is bothering her. Maybe that crying is a way of her telling you that I need help, I can't take it anymore. So remember, she's 12, the puberty is hitting, or maybe has already hit, because nowadays girls are hitting puberty really early. So be careful, she might be a bit emotional, maybe with all the hormonal changes going on, and with her having to deal with all the issues, and maybe she's a bit sensitive about seeing lots of her friends with both the parents around and not actually having both the parents, might be an issue. So there are lots of things she's going through. So first of all, I think do not forget the 67%, be proud of her, and then maybe you try to get her to talk to somebody who will be neutral and identifying what's bothering her, and then maybe looking into getting a full-fledged assessment done on her hearing and ability and all those things, and then hopefully things will change for better. But just be proud of her and remember that she's hitting puberty.
Okay. There's a very interesting question. Sonia Choksi is asking this question. Peer influence in the learning process. She's talking about this. A class would have children with different interests, and teacher does her best to create a balance. And we as parents also work on enhancing the child's strength. But there are certain influences that affect the child, and the child gets influenced. It is bound to happen. As a parent, if I feel that a certain influence is not right, how do I tell my child, or how do I help my child understand that this is an influence and not something which is her, which is the child?
Depending on your child's age. If you had mentioned your child's age, it would have been easier,
Yeah,
because if you
I heard. I'll tell you, her child is 7 plus.
late childhood. So at the moment, either the school's teacher or his friends know better. Parents don't know anything. So that's the general trend. And when they're teenagers, as a parent, you know nothing. Rest of the that's definitely there. But the thing is that you can't. This is a very tricky thing. Easiest solution is probably move the child out of the school, but that's not the solution for the problem. How
No,
you're
no,
going
no.
to talk to the child. So maybe you need to create certain stories about kind of imaginary characters based on the situations that you feel that your child is getting into. And so you create, if your child is in a stage where they would love to sit with you and listen to stories, you can tell the stories to them about these imaginary characters who got
Hmm.
into a situation where they got into trouble and how they overcome that situation. That might slowly change the way they interpret those situations or the interactions with their peers. So you know the
Mm,
situation is that my child gives all his lunch to his peers,
mm,
and
mm,
you're concerned about it that I don't, my child doesn't eat anything. So there might be an issue with the other child, so you can share it with the teacher that I'm concerned that my child is sharing all his lunch with so, and teacher might find out that the child is actually has got some safeguarding concern. But if it's other things, that talking in class, getting distracted, you can talk to the teacher about it and raise a flag about it, and also create
mm,
imaginary situation. And if
mm,
you think that your child is not at the age where they would like to listen to stories, you can have an imaginary conversation with your other family members while he is present. Don't talk to him, don't tell him, because they'll always listen to things that you don't want them to listen to. So
mm,
as if you're having a conversation with another family member about this imaginary family you know of, or you heard in your workplace, or you heard somewhere where they got into this trouble, and you, in your own way, throughout that conversation, it will be kind of enacting a drama which Vaishali can help. Situation at home where you're carrying out this conversation about, so and so's daughter got into
uh,
trouble for this, and this happened, and the later on consequence for this. Or creating an imaginary adult character who just told you about how they got into trouble when they were young because of that situation, and how it affected their learning. And often through a representation from a third party can mold their behavior in a much less threatening way, because when
mm.
we tell them do this, they hear that do not do this. So you brush your teeth, no. One of my friends, the daughter, told her, "No, I'm not going to brush my teeth, because if my milk teeth are going to fall anyway, then what's the point of brushing my teeth?"
Oh, very,
So
very
at the age of
intelligent.
7, she got this excuse. So we will get lots of these things, and that's absolutely normal part of growing up.
Yeah.
Remember, again, we are asking the kids to develop their own personality, think out of the box, and they all are unique. But creating
Mm,
this imaginary characters and conversations might give them an insight into what you're talking about. So creating the same, if same situation with two or three different characters in two or three different contexts, and talking about it informally often helps the child to rethink and mold their own action. So that might help. You can try this out. That has proved quite effective.
all right. I think we'll come to an end of this. We have come to an end of this webinar tonight. And before I conclude this, I would like to inform all the parents who are watching us that Sreepriya Bhowmik is going to work on two webinars with us. In fact, workshops for teachers and with for parents. The first one with parents is on undiagnosed or hidden conditions which affect your child's academic development or overall progress. And for teachers, it is on how to use classroom strategies and how to develop a special education needs or uh, what
SEN
did you
friendly
say?
class.
Yeah, yes,
SEN
yeah.
friendly
A
classroom.
SEN friendly classroom where uh, how a teacher can upgrade herself into identifying and working with a child who might have a requirement of help, additional help, additional support. We'll be announcing the webinars soon to all of you. But thank you so much, and again, I apologize for the delay and the break interruption that happened. But thank you so much, Shri Priyadi.
It's a
What is the
pleasure.
time in London right now? It is
It
must be
is 4:30.
4:30. Okay, so a good evening to you and a good night to
Stay
everybody
safe.
here in India. Yes, thank you
Stay
very much,
safe.
and thank you. Stay safe too, and see you soon.
See you soon.
Thank you
Thank
for
you so
tuning
much.
in. Thank you
Thank
so
you.
much. Thank you.